Healthcare is a $3 trillion industry that's growing like topsy and feeding on itself and has enormous dysfunctions. And no matter how brilliant an individual innovation is, it has a minor role in the overall ensemble. I think we have a lot of imagination. The question is, at what level do we have the imagination? Are we imagining things at the level of the hospital? Are we imagining it at the level of the patient-centered medical home? Are we imagining it on the level of the community, on the level of the state, on the level of the nation? You know, all these things are quite different. One could imagine in 10 years' time, large urban areas, maybe 20 in the United States, which have tertiary and quaternary care at the center with the big academic medical centers, but all the primary care is at the edges, all enabled through, for example, telemedicine and telecommunications, and all these devices plug into that. Well, if that's what you imagine, then you've got to design your systems to fit into that system. If you're imagining a different system, they're not going to fit into that system. So what we've been lacking is the total systems engineering. Not from a financial or legal point of view, because Washington's been very good about offering their suggestions about that, but from a technical point of view. How would we actually put all these things together? I would say the broad answer is the market, small m, and that's everybody. So communities have to get together and decide that I am a community, whether that's 10 people or 100 or 100,000 or a million or 10 million. The complexity of solving the problem goes up. If you're in a city with 10 million people, that's more than 10 times as complex as a city with 1 million people or a city with 100,000 people. So we don't have any cities yet that have really done that. We have systems like Kaiser Permanente, we have Intermountain, we have Geisinger. Those are as close to these systems as we have. They're 50, 60, 70,000 people. Well, now we need to go to the next level out. My own personal interest is in smaller cities in the states that have maybe 100 or 200,000 people. That's a good number. That's a panel that itself can involve 500 or 600 doctors or more. Four times that, 2,000 nurses or something. Now we have a real system. Now we have critical mass. Now they can look at all these things and say, well, I'd like one of those, and I don't want that one. I'd like two of these. But they all have to hook together through this telecommunications port. We don't have that port. Somebody has to design that port and really do the systems engineering. And by the way, bring the payers into that, so the payers say, actually, that's a good idea, because I can see you're going to lower costs. So I am going to give people who sign up for this thing a lower cost insurance plan than in other plans, because I can see that they are going to get better, longer term care, and they will be healthier in the long term, which will lower cost, and therefore I don't have to charge these very high insurance rates. If you look at the energy business in the United States, in 1880 the energy business was called the Standard Oil Company, and they did the systems engineering. They found the oil, they transported the oil, they refined the oil, they turned it into gasoline, they distributed it to a growing automobile market. They did the whole systems engineering of it. We need to build the healthcare backbone in the United States. So we will go through stages, but that's what needs to be done. Somebody has to imagine that right now. And the large providers like HCA or Cleveland Clinic or University Hospital Systems or the 4 major hospitals or 5 major hospital systems in New York, they're trying to do all that, and we'll keep trying things and until they work, right? Because it's just too big a problem. We need a Standard Oil and AT&T or efforts that do the systems engineering that make that possible. First is the technology. And it has to be a technology that fits into some kind of system, so have some idea of what that system is. And there's large parts of that system already. Is it going to first plug into the payer? Is it first going to plug into the provider? Is it going to be a tertiary care provider, a primary care provider? Is it going to be focused on Medicaid patients, Medicare patients, Medicaid plus patients? Private payers, all dual eligible? You got to figure all that out. Then you have to have a marketing strategy and a sales strategy that matches that. And you can't go all over the country. You can't send 3 salesmen out and have them make 2 calls a day and expect it's going to work, right? You have to put them in a dense area where they can make 50 calls a day. And so that marketing strategy has to be consistent with the technology strategy.